Kelly, and I'm here. We're doing a manual therapy treatment here with Deb Smits, and we're talking about plantar fasciitis and ankle issues. She's had hip and knee replacements, had a real bad case of plantar fasciitis. We're going to work on the ankle and the foot, and we're going to specifically be working on the tib posterior. Tibialis posterior gets really weak. It's one of those stirrup strap systems, and it's supposed to work with the peroneals on the opposite side to help hold that arch up. So she's getting a little valgus here because this is actually collapsed. Well, and she's had a surgery here, and forgot to mention about that, where she actually had the plantar fascia cut because the plantar fascia was so inflamed and she was having so many problems with it that she couldn't take it anymore. And now what we're dealing with is a separate issue where this foot now is collapsing to the outside because the plantar fascia is not there. So the subtalar joint, we talk a lot about the subtalar joint in classes. We're going to put our hands right here below the medial and the lateral malleoli on the foot and just grip it like this. And I love this technique that we do because what I'm doing is I'm really tractioning up on the calcaneus. And as I'm doing it, I can also redirect it back up on top of the talus. Remember the calcaneus is sitting below the talus. That subtalar joint right there is really important. She's going to get some cramping maybe from that, or it could be sore too. So tractioning, how's that feel?
Okay.
Good. And then as I move it, we want to wiggle that subtalar joint. So sometimes we pick it up and we wiggle it. You'll see us do this. Great technique. Just to help set those on top of themselves and realign that and mobilize those areas. It's really good. And it's decompressive. So it's really good to get this first. And then after we do that, I like to do this one. If the ankle's too big, you don't do it. Put your fingers alongside of it. I come along. She doesn't have the plantar fascia, but then we just do the circle. And as I'm doing this, I'm really trying to feel where this inversion or eversion is not. Where is it restricted? What can I do? And then just give it some of these circles like this. And work the foot, work this foot. Remember, it can move in all these planes of motion, and it has to. It's reporting all of everything that's going on to the vestibular system, into the proprioceptive system, into the ocular visual system. All those systems that are reflexive have to come through this ankle. And if you've got people out there that have plantar fasciitis, the ankle is extremely important. Once we get done with this, I would take them into the gym, and we have some physiokinetic stuff we do with our proprioceptive pads that helps re-strengthen this. So I hope you like that technique with ankles. Use these, and we'll be teaching these on the road.